Okay, so Anna, when I first met you, actually I met you at a screening in the spring, and it was I think you were you either had a walker or you're in a scooter. I can't remember one
I
of the
was in a
two.
wheelchair.
You were in a
Yes.
wheelchair.
Yeah.
Okay, so well, how do you walk into my office now?
Well, now I can get in with just my cane.
Just a cane.
Yes.
Yeah,
Yeah.
and then and so without going all the details about your particular case in terms of your mobility, how's it been for you in terms of what we've been doing here?
My mobility has improved a lot from the time I first met you.
Yeah,
As far as endurance, the length of time that I can stand and do activities now has lengthened
yeah,
than it was before, and also the amount of pain has lessened
yeah.
as well.
Now, one thing I always like to do when I always like is always take educational moments when I can do it at any time, as you know. So well, that's awesome in terms of radically changing in terms of your ability to stand longer and be able to do more and have more freedom, which is amazing. But in addition to that, the nervous system also controls like your vital organs. And I'm just looking at your questionnaire. That's why you're still wearing your examination robe as we do this video, as because you stopped taking what right now?
I stopped taking my blood pressure medication.
Because you're like a rebel, or because your blood pressure's dropped?
No, my blood pressure had dropped.
Yeah.
And I had stopped taking it 2 months prior to my doctor's appointment. And then at my appointment, he said it was perfect, right where he wants it to be.
Right. So, just as a moment with just your case, which is awesome, is that your nervous system is controlling your blood pressure. I mean, it can be affected by different factors, but one of the things, then there's been some chiropractic studies as far as the effectiveness of dropping blood pressure to the same as someone taking two different blood pressure medications. And the type of blood pressure you have fits that bill completely. And so, do you think by changing the structure in your spine, improving the overall neurological function, have you just reduced your blood pressure, or have you addressed the cause of this blood pressure?
I think we've addressed the cause of the blood pressure,
Right.
the reason for it being so high.
Yeah. As a result, now your blood pressure is normal just by restoring normal function to your spine, normal neural function, and normal neural function means normal organ function, which means a longer, healthier life, better
Yes.
prognosis.
Yes.
So thanks for sharing this with us, because there's people that are out there right now like you who have lost hope. And by the way, what was your state before chiropractic? I mean, I met you in a wheelchair, for goodness sake. So what was the outlook on life, and what can be done for you at that time?
Well, I was afraid that nothing could be done. And I had asked, are you sure that this could help me? Is what I was concerned that I was at sort of my wits' end of where to go for help.
Right.
And wanting to not be in a wheelchair, wanting to be mobile again, but thinking this is where I'm stuck.
And then God prepared the right place at the right time, made us come together.
Absolutely. That's right. Yes, absolutely.
Awesome.
Yes.
Thank you very much.
You're welcome.